This is Dr. Kaz Zymantas at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue here in beautiful Naperville, Illinois. Some of my patients ask me, what is the difference between a cleaning or hygiene cleaning appointment and a deep scaling cleaning? A regular cleaning visit is also known as a hygiene appointment. Patients usually show up for hygiene visits every 6 months. Sometimes patients need to come in more frequently because they may build up more plaque and tartar or calculus than the average patient. Plaque is the sticky film that grows on the teeth and roots if it is not disturbed by brushing. Calculus is mineralized plaque that cannot be cleaned off of the teeth easily once it forms on the teeth. So patients that do a relatively good job at removing the plaque buildup on a regular basis only need to be seen every 6 months if their periodontal condition is stable. I would like to digress for a moment. There is a small space in between the tooth and the gums, and we call that space a periodontal pocket or just simply a pocket. This space is 3 millimeters or less with no bleeding in healthy patients. Healthy tissues never bleed. When plaque builds up on the roots of the teeth, there is a reaction of your body to the foreign material building up. Your body begins to think that your tooth is a foreign object. The gums surrounding the teeth become infected, and they also begin to open up, and the pockets begin to become deeper over time. Untreated periodontal disease usually ends with the loss of teeth. Your breath will begin to smell worse because of the presence of pus due to the infection. Pus is the yellow fluid that is associated with infections. When the pockets get deeper than 3 millimeters, you may need to have a procedure called scaling and root planing, sometimes also known as deep cleaning. The patient is usually numbed up for this procedure so that the root surfaces can be thoroughly cleaned. So one can see that there is a large difference between the two procedures. The goal of scaling and root planing is to get nice clean roots so that the tissue can reattach to the tooth and reduce the depth of the pockets. Most people cannot clean pockets that are 4 millimeters deep or greater. This is when they may need more treatment to reduce the infection in the gums. There are also significant overall health risks if one does not treat the advancing problem. There are studies that show that patients are more at risk for heart attack, stroke, and certain cancers because of the disease in your gums. You can see other videos regarding problems associated with periodontal disease and how to treat these problems at my website below, or just call us at the number listed below. I hope this video is of great help to you. Keep this in mind. Here is our slogan: let's fix small things before they become big. We are in the business of prevention, and nothing can be prevented more than dental problems. In the whole field of medicine, you will not find anything which can be prevented more than dental problems. The top of the technology in order to prevent most dental problems has been reached. Have a good day. Bye-bye.